So welcome also from my side. I'm Heidi Oblom. I'm a PhD student at Akademi University, and during the past year I've also been at the University of Copenhagen to do a research stay. And today I thought I would talk briefly about if 2D and 3D printed dosage forms could be used in a hospital pharmacy setting. So the presentation I will give a brief introduction to the topic. Of course, Ingun did that very well already. And then I will go over the aims of the study and walk you briefly through the different methods that was used in the study. Then look at some results and also introduce you to the concept of data-enriched edible pharmaceuticals. And then look what still needs to be done and where we are with the future perspectives. So as all of you may know, and as we heard already in Ingun's presentation, is that there is a lack of age-appropriate medicines for pediatrics. And this is especially a situation in hospital wards where there's a lot of different medications that need to be given to pediatrics and young children. So it might be that there is simply not the dose needed available, or the dosage form itself might be unsuitable. It might be very hard to administer or something else, or then the excipient present in the dosage forms may not be safe to use for children. And as we saw already in Ingun's study, we usually end up with something as a situation on the right-hand side of the tablet when we try to manipulate these commercially available dosage forms. And this then, of course, leads to inaccurate doses and dose fluctuations from day to day. And this can be quite a safety hazard, actually, for medicines that have a narrow therapeutic window. So at the hospital pharmacy, there is a bit more flexibility than what you can do than just at home. There is not much else, and you can just split the tablets. But in the hospital pharmacy, they can make oral liquids or capsules, or oral powders. And these, of course, all have pros and cons then with regards to the flexibility of the doses and stability, taste, and so forth. So it's still not perfect as it is. So that's why we thought that, okay, could printing then be used in a hospital pharmacy setting? And as all of you that are interested in printing and here today know that there has been a lot done in this field during the previous years, and on the right-hand side, you can see also a picture of some examples what has been tried out with the different techniques available. And why printing would be a good solution is because it has a very flexible and precise nature. So it could be possible to make personalized medicine with regard to the dose or how the drug is released, for example, but also it is suitable for on-demand manufacturing. So the aim of the study I will be talking about today was to compare two different printing methods to produce varied doses of warfarin, and then compare that to what they use today at the hospital pharmacy in Helsinki, and also to have a look at the quality of the printed dosage forms and oral powders that we made. So the study was done in a collaboration with Helsinki University Hospital pharmacy, and that is the biggest hospital pharmacy in Finland, to my knowledge. And it's also the hospital pharmacy that delivers medicines to the New Children's Hospital in Finland, which is also the biggest children's hospital. So here's an overview picture of all the different methods we used in this study to kind of make it easier for you to visualize this. So on the top, we have the semi-solid extrusion 3D printing that was used as one method. So here you start off with a polymer solution where the API is dissolved in this, and this is then printed into single dosage units, and here in this study as or dispersible films. And in the middle, we have the inkjet printing, which has a bit of more steps than the previous method. So here we need to make substrates first, and then we need to make a printing ink where the API is dissolved. And that is then imprinted on the substrate, and it's finally cut into or dispersible films again. And on the bottom, we have the oral powders. So here in the hospital pharmacy, they use conventional tablets, and these are then ground and a filler is added, and then they're simply weighed into the single dosage units. So you might wonder, why did we use warfarin in this study? And we had a look at what kind of compounds or drugs are they compounding in the hospital pharmacy. So in 2008, it was 8% of all the compounded dosage forms contained warfarin. So we thought this might be a very relevant drug then to study. And this dosing range was also quite large here. So we can see that of all the doses they made, the doses were between 0.1 and 2.3 milligrams, and the most common doses were 0.5 and 1 milligram. So in the study, we wanted to have target doses for different ones within this range. And here in the table below, you can see the size of the or dispersible films for the difference method that we designed. So let's start with the semi-solid extrusion 3D printing. There was a wish from the medical doctors that the formulations would be as simple as possible, to not add anything extra, because these are again should be given to children, so we don't want any extra if there's not an absolute need for that. So we started with a 15% HPC solution that was dissolved in ethanol and water, and the warfarin was also dissolved in this. And then it was printed with the biobots that you can see in the picture here below. On the right-hand side, you can see the different doses of warfarin that we made with this method, and how we came up with how much drug we need in there. So we went with a simple solution. So we printed placebo formulations, weighed them, and then we could, based on that, calculate how much drug we would need in the solution. And we decided to go with the average value, which is 1.5 here. So if you can see, the 0.1 milligram dose would have actually required a little bit less drug. So we would either have needed two different solutions, but this we didn't want to do, or we would have needed to manipulate the G code of the design. But we decided we go with the 1.5, but keep this maybe in mind when you look at the results later. Then over to the inkjet printing. So again, we wanted to compare how these methods themselves work. So we wanted to have very similar formulations, even though the printing, it's not possible with the printing methods, but we wanted to make them as similar as possible. So again, for the substrate, we used the same 15% HPC solution and cast that into substrate. And the printing ink was then where the drug is dissolved in PG, water, and ethanol, and then a colorant is added just to visualize the printed area. And we used a picture printer to imprint this substrate with the drug, and a single layer was used for this, because we thought that would be the fastest and easiest way in the hospital pharmacy to do that. And this picture is very neat in that sense that you can visualize every droplet that is ejected from the printer, so you can analyze the volume of the droplet. So based on this, we could then calculate the required DPI, so how many drops per inch we would need to deposit to obtain a specific dose. And on the bottom here, you can again see the printed warfarin doses. And here we wanted to show that as a separate step, you can use a drug-free ink also to print information-rich pattern on top of these. So A and B is the 3D printed or dispersible film, and C and D is the inkjet printed or dispersible films. And I will get back to you later in the presentation why this could be then useful. So as the last method, we have the oral powders. So these were made in the hospital pharmacy according to the SOP that they have. So these are made by technicians in the hospital pharmacy in the exact same way that they would be made if a patient at the ward would need them. So it was ground commercial tablets, and as a filler, they used lactose to make a mass, and then this was weighed into individual sachets, as can be seen here in the picture. So let's look at some results of this. So let's first look at the graph on the right-hand side. So the different methods are shown in different colors here. And then we have a 4-column for each dose. So the first one, the gray column, is the target dose. And the 3 other columns represents the different batches. So we made 3 different batches on 3 different days to kind of look at also the repeatability of these methods. But as you can see from this, you cannot really say, okay, which method is better than the other. So we calculated the uniformity of content according to the pharmacopoeia. And as we can see here, the 1 and 2 milligram, all the doses and batches complied with the limits stated in the pharmacopoeia. Then when we go to the smaller doses, that's where we can see some problems and challenges. So for the 0.5 milligram, again, all the printed or dispersible field complied with the limit, but only one batch of the oral powders. And when we go to the 0.1, there was one batch of all the methods that did not comply with the limits. So still some work to do with the precision here with the methods. We also calculated the acceptance value, and here we could see that the semi-solid extrusion 3D printed was the best method of all these methods that we looked at. So we can say that semi-solid extrusion 3D printed had the best accuracy and precision. And what we can also conclude from these results is that the smaller the dose, the more challenging it is, but that is also commonly known, of course, in the pharmaceutical field. We also wanted to look at the manufacturing times, because in the hospital pharmacy, they have a specific time frame within that they need to deliver the dosage forms to the ward when a patient needs it. So it cannot be that the method is really good, but we have to wait for 1 day before we can deliver them, for example. Of course, it's quite hard to also compare these, because as you could see in the beginning, they require very different steps. So we looked at the actual printing time here for the printing methods, because we also think that if this would be in the hospital pharmacy setting, of course, you would need to have pre-made substrate and inks to make it easier for the technicians that will make these. So for the 3D printed dosage form, the biggest one, that would obviously take the longest time, it took around 3 minutes to prepare, so quite a long time, to be honest. This could be drastically reduced if you would print more than one at a time. But then you also have because the most time is when the printing head actually starts moving and going to the place where it will print, and so forth. So you could print more doses at a time, but then you have the problem with leveling the build plate. So if there is even small fluctuations in the height of the build plate, you will have different doses, of course, which is not good. Then if you look at the inkjet printing, that was a quite fast method, so roughly 20 seconds to make the biggest dose. And here I want to point out that we in this study used quite a lot of nozzles, so roughly 50 in the different batches. And of course, if you use less nozzles, then it will take a longer time. And typically in these inkjet printing papers out there, people use 1, 2, 3 nozzles, because obviously then you have a less fluctuation in the droplet volume, and the results are better. But we wanted here take the risk to use more nozzle to make it faster, because that's how we see it would be done in the hospital pharmacy if it would be used. And then the oral powders took from half an hour to an hour roughly to make 30 of these, and this depended on the technician then that was making them. Some are more faster than others. And here the weighing step seems to be the one that takes time and is the tedious one. In the interest of time, maybe I just quickly point out a few things on this slide. So the mechanical properties of the dispersible films were all good. They were flexible, did not break when they were handled. And the dissolution of these different dosage forms, regardless of the preparation methods, were very similar. So what can we conclude then from this study is that what we can see here and now is that the 3D printing method was best in this according to the uniformity of content and acceptance values. And what we were really happy to see is that both printing methods performed equally good as what they use at the moment in the hospital pharmacy. And or dispersible film obviously have some other advantages as well, that they can be easily administered without the need of water, because these patients also usually have a water restriction, so we cannot give them large volume of water, for example, during the day. We also tested that they could all be administered through a nasogastric tube, because this was a wish from the medical doctors there, because if the patients have a nasogastric tube, then they want to also administer ideally the medication through there. So it needs to see that we can administer it that way as well. Then the inkjet printing was found to be the second best method in this study. And here I want to point out and I want to defend maybe inkjet printing a bit here, because we did not spend a whole lot of time on ink development and looking at the different printing settings, which then could increase or give better results for this. So this was a very straightforward study in that sense. But I also want to point out here that the advantage of that you can include this information-rich pattern with information with this technique. And then with that, I will jump to this next study that I did here in University of Copenhagen. We call these data-enriched edible pharmaceuticals, or DEEP. So the idea here is that you have the drug and the colorant in the same ink, and with a single step, you can personalize the dose, but also the information that you print on this. So they don't need to be all the same. You can have a personalized data or information depending on the drug that you are using. You might want to incorporate different things. And this can be then done in a single step and on a single dose unit level. So in this example, we used medical cannabis, and the idea here was that there are still some doubts about using cannabis as a medicine, and it could be ideal to be able to trace this from all the way from when it's manufactured until the patient scans this right before they take it. But imagine in a hospital setting, for example, you could print the patient's name, dose, and when it needed to be taken, and then the nurse, before administering this, could scan it by the patient and see, okay, this is the right patient, I'm giving it to the right medication and the 9 a.m. dose, for example. So this could also increase the safety of the patients and reduce medical errors. So I think the sky is the limit here, what you can do with this, and of course it depends on the medicine and the molecule and what are the information that would be needed for that exact drug. So of course there's some hurdles still to overcome because we don't have these printers in the hospital pharmacies yet, or at least not in every hospital pharmacy. But there are clear advantages. So as I showed you today, is that they have good precision and good content uniformity. And we also looked at the stability, and that was also, they were also stable over 1 month. And of course, the biggest advantage of these printing technologies is that they are very flexible. So regarding the dose or even the shape, size, and so on, you can do a lot with this. And I also want to highlight again the inkjet printing and the possible to include data or personalized information on this, that it's not maybe easy to do with other techniques. But of course, we have still some hurdles to overcome. So if this would be a reality, as I already mentioned, we would need to have someone who makes these substrates and ink. So it's easy for the hospital pharmacy then to make these, just kind of to press print and they would get the required dose. Also, as I already touched upon, is that the drying time needs to be shortened, because usually there's a limit of, I think, 2 hours that they need to deliver this to the ward. And also suitable non-destructive quality assurance methods, linking back to the regulatory issues that Ingun talked about. And then, of course, we needed GMP printers, so either disposable parts or parts that can be clean, so there is no cross-contamination and so on. And of course, there's the investment question in new equipment. Some of these printers can be quite expensive, as the picture I showed you earlier, but some also are quite cheap. But still, there is a need for investment in training of the personnel, so they can do this in a safe way. So with that, I would like to thank some people from Akademi University and University of Copenhagen, and also the technicians at Hus Pharmacy that made these dosage forms, and also Nordic POP and the Finnish Cultural Foundation for funding my PhD. And with that, I would be happy to answer any questions or hear any comments.